Question number 9, Joanne Hayes.
Thank you, Mr. Speaker. My question is to the Minister of Health. What progress has been made towards achieving the government's national health targets?
Speaker.
The Honourable Dr Jonathan
Mr Speaker, today the Ministry of Health published the health targets for April to June 2016. They show great progress overall, with the improved access to elective surgery target again being achieved. In fact, it's been surpassed by 8%, but of course there's always more to do. This is the final time that the more heart and diabetes checks target will be reported, and it has exceeded the target, with 91% of the eligible population having had a cardiovascular check in the last 5 years. The health targets are important as they drive performance across the health system, ensuring that New Zealanders get better access to key health services.
Supplementary question, Joanne Hayes.
Thank you. What steps has the government taken to improve access to health services in Christchurch?
The Honourable Dr Jonathan
Mr Speaker, on Friday the Prime Minister opened a new $215 million Burwood Hospital in Christchurch. With 230 new beds and being 32,000 square metres in size, Burwood is the largest rebuild project in Christchurch East and a great addition to the Canterbury health system. Key features include more beds for older persons' mental health, stroke and more brain rehabilitation. Each floor boasts shared allied health spaces such as gyms to support the patient rehabilitation process. Burwood Hospital is the first cab off the rank in the close to $1 billion of hospital redevelopments underway in Christchurch. Our focus will now be on delivering the new $72 million outpatients facility and the $445 million acute services building on the Christchurch Hospital campus in 2018.
Point of order, the Honourable Annette King.
Mr Speaker, I seek leave to table an article from the New Zealand Medical Journal, which is not readily available, dated the 19th of August 2016. No, it's not, stating...
Order. This is a point of order.
Can I start again, Mr Speaker?
Yeah, the member can start again, and I don't want any interruptions from my right.
I seek leave to table an article from the New Zealand Medical Journal dated the 19th of August 2016, stating the childhood obesity plan is unlikely to solve New Zealand's obesity crisis. It's based on a dated paradigm.
Order. Leave is sought to table that particular document. Is there order? I'm putting the leave. Leave is sought to table it. Is there any objection? There is none. It can be tabled. Question number 10, Chris Hopkins.